Hi, my name is Deanne Bruner. I am the Regional Nutrition Manager with Sodexo and formerly the Clinical Nutrition Manager and Director of Patient Services for Tallahassee Memorial HealthCare with Sodexo. I've been a registered dietitian now going on for 26 years. I have an undergraduate degree in dietetics, a master's in business administration, and currently working on a master's in professional studies in nutrition from Penn State University. The internship at Tallahassee Memorial in conjunction with Florida State University, we're able to meet all the requirements of all the rotations for the intern. So it's really nice to have an intern from the beginning of their internship to the end. They're able to do their food service rotations, their community and wellness rotations. They're able to do the specialty rotations, which includes long-term care, cancer, outpatient cancer center, and the metabolic health center, as well as do their clinical rotations here. The food service rotation part of it is really important because they spend those 4 weeks with me as the manager of the department, as a senior leader, and they learn different things of how a registered dietitian plays the role in a food service operation and a clinical nutrition operations. Since I have been here for the last 6 years, we have probably hired at least 8 FSU dietetic interns who still continue to work here at TMH or have been promoted and gone to bigger things with TMH or with Sodexo. Our role has really grown over the last 6 years to now we're actually servicing and actually teaching the medical residents in family medicine and internal medicine programs here how they provide nutrition education. So actually the dietitian is going in with the physician and the resident to teach them how to provide nutrition education and the importance of that. So it's always a different day. It's never boring. Some days go really easy. Some days go a little bumpy. But I think the primary role here is to make sure that they know I'm here as a resource, to make sure I know I'm here to help them solve issues. When my supervisors are having issues, how can we be innovative to solve staffing issues, patient recovery, do we have an upset patient, and also lots of training and education. What's our role in training and education for the employee? So when I get an intern for the food service rotation, one of the first things the interns say, are you going to have to work in the kitchen? And I say, no, we don't work in the kitchen. What we start with mainly is I actually give them a list of questions. So I want them to go look up and find out, one, what regulations is required in a hospital setting. Also, since we do have a skilled nursing facility, we have to follow those food service regulations. So it starts out as information seeking, and then we build off of that. So once we get through those questions where they can find out, get more familiar with the food service operations, then we decide what we're going to do. So they have to participate in the orientation. They have to participate in diversity, inclusion, and equity, or DEI, diversity, equity, and inclusion training. And then they'll actually start to develop to where they will start doing a training or an education of the staff. They'll also shadow a hostess, and they'll shadow a tray line person, and then they'll actually go then shadowing a supervisor, and then they'll start being more actively involved. But like, if you only have this many hostesses today, what would be our game plan to make sure we get everyone done? So it kind of progresses through the 4 weeks to where it's more information seeking, and to the end we close it out to where they're actually able to do a menu project or a meal development project or a quality improvement project. Just depends on what the needs of the business is going on, to where they'll actually have a handle in that. So several of them have created deliverables that we're still using today. One of our former interns did something called Diets in a Nutshell, to where it's actually a cheat sheet for our hostesses and our hosts, to where they can see a therapeutic diet and what's provided and what's not allowed on that therapeutic diet. Other deliverables, they've done a lot of food insecurity. They've helped us do education and training. They actually did 1 year, they actually did the entire safety fair, where the annual competency fair for safety, where they each developed their own boards and conduct their own safety training for all of the food service employees. So it progresses over that to where they actually have done a project by the end of that rotation, to where it's actually a deliverable that they can show that they have done. Not only do we have resources for TMH, they have resources to Sodexo available to them. They have resources to HR. If we, like we had an intern, she was interested in the 6 Sigma Lean training we did, so she was actually able to go work with the project management team to do that. So if they have a special interest in management, we definitely get to that person to give them the resources, and also try to set them up with a person they can at least shadow for 1 day with that. So the expectations of the intern is, one, they have to have a good work ethic. You have to be willing to come and just be able to work. I think that the most important thing is you have a willingness to learn. This may not be your ideal of what you want to do, but if you don't come in with an open mind and be willing to learn something new, you may miss on something that you really enjoy. A lot of people give the perception of food service as just making sure we're serving food, but it has nothing to do with that. That's a part of it, but the role of the dietitian and to make sure the expectation of the interns, they understand their importance of that in the food service operation for food safety, patient satisfaction, making sure the meals are appealing to that, making sure we're following the therapeutic restriction. So the expectations again of the intern is to make sure they have a good work ethic and they have a willingness to learn and be engaged in the rotation. There may be times that the intern is not meeting expectations, and that's when the one-on-one coaching is going to occur. So we're going to sit down and talk to the intern. What's going on? Maybe it's just too much for them to handle with schoolwork. Maybe it's just nerves. Maybe it's me as a preceptor not explaining them or feeling like they're part of the team, or it could be just boredom. So somehow we got to figure out what's making them not feel engaged with this rotation. And when we do that and we have those honest conversations, then they'll be able to build upon them. So sometimes it's just making sure those expectations are known in the beginning. And if I feel like an intern is struggling, let's just sit down and see what's going on. It may be something that's just bothering them personally and they just need someone to talk to. So it's definitely a one-on-one conversation. TMH, Tallahassee Memorial, and Florida State University have a wonderful working relationship regards to the dietetic internship. Both of us learn, the interns teach our dietitians and the dietitians teach our interns. So it's something that's very important to have. It's very important to continue to do this for the retention and for our profession, and also develop a skill set to show that dietitians, if you are able to do this, that there's such a wide world open for you for opportunities in healthcare and management and in non-traditional roles.
Well, welcome to the Tallahassee Memorial Metabolic Health Center. I'm so glad you all could be here. I'm Nancy Smith. I'm the lead dietitian here at the Metabolic Health Center. And we have 6 dietitians, 5 full-time and one part-time working with us in our 3 departments, which are the Diabetes Education program, the Lipid Center, as well as the Bariatric Center. I'm a graduate of FSU, a proud graduate of FSU. I got my bachelor's in 1982 and my master's in 1992, so I've been a dietitian for 30 years. All of it spent with TMH. The first 5 years were in the hospital as a clinical dietitian before I transferred to the Diabetes Center. So I am a certified diabetes care and education specialist and also a clinical lipid specialist. So in our lipid center, we help people with problems with their cholesterol and triglycerides. We have 2 lipidologists in that department that I work with, and I also work closely with our bariatric program. We do a lot of follow-up, especially with our bariatric patients, and also a lot of nutrition education and medical nutrition therapy for lipid patients and bariatric patients. So a lot of nutrition counseling. We have group classes that we teach through our bariatric program, an introduction to nutrition for people trying to lose weight, and also the special nutrition for people that are having bariatric surgery. Those are both taught in group classes. The FSU interns spend 3 weeks with us. Which gives them some of that time to observe some and then actually put some of what they've seen into practice. We have the interns observe us in both the classes and the individual nutrition counseling, and then have them take on some of the education duties to practice themselves. So we might have them teach the plate method of meal planning in an individual session. And for instance, we have a gestational diabetes class that's taught every week by one of our dietitians. So after the intern has observed that once or twice, then we'll have them teach part of that, maybe the carbohydrate counting portion or the label reading or both. Because this is a specialty practice, working with people with diabetes and obesity and lipid problems, we usually have the interns come to us after they've done their clinical rotation at the hospital. So usually then they're prepared to do some of that teaching after they've observed us. We have a wide variety of educational handouts. These are just a couple of examples of things that they might teach from, some basic handouts. But we've also put together notebooks of helpful articles and resources on diabetes and lipid disorders as well as obesity. We provide the intern with a packet of questions to answer, definitions about diabetes and the other conditions and case studies for them to answer. And then we go over that with them at the end to help them make sure that they have, the understanding. We expect them to conduct themselves professionally and to follow the TMH professional appearance guidelines. We expect them to be interested in learning and ready to take on a little bit of teaching, nutrition education while they're here, as well as if we have other projects that might be useful for them to do, like writing up a new handout on a subject that is needed, or researching a topic that we need more information on. If an intern was struggling or not meeting our expectations, I would sit down and talk with them and find out their perspective on how their experience here was going, and find out if maybe there's something going on that I'm not aware of or some part of it that they're struggling with, and then let them know how they're not meeting our expectations and see if we can find a solution together. We enjoy working with the interns from FSU. We feel like it works very well when they come to us after the clinical rotation. And we feel like it's part of our role as a registered dietitian nutritionist to, mentor the next generation.
My name is Robert Anello, been a registered dietitian for 5 years. I've been working at TMH for about 3.5. I graduated from Florida State with my master's degree. Prior to that, I was at the University of Cincinnati for my bachelor's degree in dietetics. Here at TMH, I work specifically on the ICU floors, the neurology step-down unit, and the GI floors, to where I also work with TPM patients as well. Typical job duty for a dietitian here in the inpatient team. We'll come in and we'll screen our floors. So basically we'll print out what floors all of us are assigned to and look at our daily task list. So new patients that come in, or if there's consults that a doctor wants us to see a patient, we'll mark those down for each floor that we have and see those patients throughout the day. So in the morning time we'll go out, talk to the patient, find the nurse, talk to them, and then if there's something we want to clarify or think that something needs to be added to any kind of order, so like maybe we want to start enteral nutrition, we can call the doctor or get with them through Volt, which is the texting system in the hospital that practitioners can talk to with each other. So that's a very good way to get in touch with anyone that you need. So after we're done assessing the patient, we'll come back here, type up our notes, and that's essentially a day. I mean, you're seeing about 12 to 15 to 17 patients a day, depending on what kind of floor you have. So you might be really busy with a lot of patients, so it could take the whole day just seeing patients and then charting on all of them. So typically when interns are here, they're here for about 8 weeks, sometimes even longer. Each dietitian, we have 8 currently. They'll have them for about a week or 2. So when we have a intern, in the beginning we'll introduce them to the whole charting, how to talk to a patient, and throughout the internship they should be pretty well versed on how to assess a patient, what to look for by the time they're seeing the ICU patients and doing TPNs with them as well. So when interns first start, we'll put them with one of the more experienced dietitians to watch them, how they will assess a patient, what to talk about, what things to look for. So when interns start out, they're really scared to do an assessment. They're very robotic in how they ask questions. But as they progress through watching how every dietitian does something different, they become more confident. By the time we get to the ICU, towards the end of their internship, they are able to go in, assess. They can actually talk to doctors and nurses without being nervous at all. And so towards the end of the internship, they will do about the last 2 to 3 weeks on critical care units, seeing ICU patients, and then they'll do staff relief. So kind of helping out anyone that needs more help on other floors. So they'll be able to see just about everybody towards the end. The type of things that we'll work on with interns, the biggest thing is how to do an assessment with the patient. When we're discussing with the intern what things to look for, we'll want to stress the ADIME, and it works pretty well once we're done and coming back to the chart, because everything is broken down for us. So you have the whole assessment in the beginning, and then we start going into the diagnosis, which is its own tab, and then going into the interventions and the monitor and evaluate. The interventions are the first thing that pop up for our chart. So when a doctor opens up our note, the first thing they see is the intervention. So we want to make sure that everything we stressed on what we talked about with the patient that we want to change is right there for the doctor to see. So an intern has a lot of different resources here. The first thing that we have, so we have 8 dietitians that all have different experiences and knowledge in certain areas. We have a dietitian who specifically is our peds dietitians, and she actually has certifications for advanced care in pediatrics. We have a nutrition support dietitian who is certified to do TPN and critical care, and another dietitian who is working on her oncology nutrition certification. So most of us have a lot of experience as well. A couple of other resources, we have the Florida Dietetic Association MNT manual. So if there's anything that they were wanting to look at specifically with diets, they can easily look that up. We also have the online A&D library. So if there's any handouts that they would like or educations for patients, we can pull up any type of paper on that and give that to a patient as well. So if there was something that they were wondering about certain diets, that's also something they can look up. Other resources we have is prior to starting a new rotation with a dietitian, whatever floor that dietitian covers, there's a workbook for that floor. So I try to get more questions geared towards that, and also what they'll see. So certain medications for chemo, what is that going to do to the patient nutritionally, what kind of labs would we want to look for, and then for the ICU, how to read all the pressors or other sedatives that a patient is on and how that would affect them to have, because some of them have calories in them, so how are we going to address that when we start enteral nutrition? So our expectations of interns, specifically from Florida State, we've gotten many good interns from Florida State. We just want you to come in, be hardworking, listen to what we have to say for what kind of recommendations we like, and just be on time. Everything else will usually fall into place because we know that the interns are intelligent enough that they'll be able to make good recommendations. And any other questions that they have, we'll be happy to follow up with them, whatever they have. So if we do find that an intern is struggling a little bit or kind of lacking in some key parts, we do have that midterm evaluation to kind of see what things to look for, what things to improve on, and what things are you doing well in. So if there are things that they are struggling in, what we would do is kind of get with what preceptor they had, and what are some ways we can help improve. So whether that's with interviewing, whether it's making better recommendations for MNT, and what resources we can give them to help that, whether it's going to be in the workbooks or in the manuals that we can. So specifically with this room, we do have telehealth in here, so if there are patients that are isolated with COVID, or if they are having, we do have an outpatient clinic that we would see patients at, this room would serve as that room. It does have a privacy component to it.
My name is Afaf Kasem, and I'm the Director of Quality of Life Services here at Tallahassee Memorial HealthCare. I've been a dietitian for about 7.5 years, and I've also worked at TMH for about 7.5 years. I am a proud alumna of Florida State University, the College of Human Sciences. I received my bachelor's in dietetics from FSU and my master's in food nutrition science, and of course, completed my dietetic internship. My role here at Tallahassee Memorial HealthCare is very much a non-traditional dietitian role. I do love it. The best thing about this role is every day is completely different, and my favorite pieces of this role are really the engagement piece, engaging the community and improving quality of life, our patient populations, and of course, the heart of everything, our colleagues that do all of the work. A typical day in my job at Tallahassee Memorial is really varied. I might be out in the community providing education or virtually. I also might be engaging our colleagues in different programming we have to improve outcomes. I may also be working with education for patient populations on nutrition, health and wellness. I'm also super involved in the community in terms of creating education like blogs and videos and making sure that our education is something people can understand and really utilize and apply to their everyday lives. An intern is typically with me for about 3 weeks, and a lot of times I take full-time or part-time interns. I'm very much about balance, and I want to make sure the interns understand that their schedules can be flexible while working with me. Our dietetic interns work on a lot of different projects here, and of course, like I mentioned, they may be working on patient education. They may also be working on even writing a blog for the community members. Also, we have our colleague engagement initiatives that we work on here within our departments. In the food and nutrition department, I also assist in the environmental services department. A lot of our dietetic interns, when they first start here, know that this role is a non-traditional role for a dietitian in the community setting and in a healthcare setting. So at first, there might be a little hesitation on how to navigate a lot of the projects, but I really take the time to mentor our dietetic interns and make sure they're comfortable with a lot of the project specifications, the deadlines. And at first, a lot of times they may not be fully aware of how to go about doing it, but by the end of the rotation, I always get feedback that it was super helpful to kind of see the back end of what it takes to put on an educational program, to work with different colleagues and different managers, because my role really entails teamwork. It's a big part of making sure these projects are successful. So our dietetic interns always provide feedback on what they learned, and most of the time I'm hearing things like, I didn't realize the complex, multifaceted parts of your job, or what it's like to put on a program on the forefront, what's happening on the back end. So I always get feedback related to that. Dietetic interns have a lot of resources available to them. The education we provide in the community, we utilize the USDA MyPlate guidelines, of course the dietary guidelines for Americans, the Academy of Nutrition and Dietetics. We utilize a lot of the science-based evidence. And then we also have a plethora of different files and folders of examples of what we've done in the past, and even what dietetic interns have done in the past. We'll highlight the best work, and we'll showcase a lot of the times where the barriers lie, so they're able to understand and learn how to develop a program that's effective in the community. A big project that dietetic interns really understand while they're working here is the Community Health Needs Assessment. So every 3 years, every nonprofit hospital has to do a Community Health Needs Assessment. And the importance behind the assessment is to really have our community's voice heard in the healthcare needs, in the gaps in services, and then we create partnerships and programs to meet those needs with our community partners. So our dietetic interns really get a feel for what is it like to understand the population, to know what their needs are, and to really remember that it's their voice being heard. And so we offer a survey, we understand the information that comes from that survey, and then they help us create interventions that might be appropriate to meet those needs. My expectations of a dietetic intern is to just keep an open mind, think creatively, try to get those innovative ideas out, because like I said earlier, I am in a non-traditional role, so a lot of times we've got to think outside of the box in order to achieve a lot of the programming needs. And so biggest thing is keeping an open mind and realizing that, you might be in a community rotation, but the skills you learn here can be applied to any setting. When dietetic interns may not be meeting the expectations we set up, I really like to discuss it with them, ensure that their voice is heard, and kind of go over any barriers that aren't allowing them to achieve those expectations. I really enjoy mentoring them, and oftentimes it's miscommunication or misunderstanding of expectations. And if that doesn't really resolve the issue, then I do involve the dietetic internship director just to ensure that there's open communication between all three areas. Okay, so Marina, your rotation is coming to a close. Can you share with me some of the things that you learned in your rotation that maybe some dietetic interns wouldn't know before they come into this rotation?
Yeah, so I think the biggest thing I got from this rotation is just learning all of the legwork that goes into community events and interventions and programs. When you're taking a survey or something like that, you don't think, what went into making this happen?
Mm-hmm.
So all of the meetings that you go to, all of the facilitating, trying to figure out where can we put this event, how are we going to get the community engaged, making those connections within the community to, if someone comes into the community, if they don't know them, you're not going to get that community engagement. So just making sure that you're hitting all of those parts to make something happen. It was really surprising to me how much you do and how multifaceted your entire, your work is.
If there was one skill you would say that you developed in this rotation that you would take with you, no matter the setting, what would you say that would be?
I would say just talking to people that you don't know, just reaching out. A personal example is I've been doing community surveys, and I'm not really the type of person to reach out and go, hey, can I talk to you for a second? And I feel like I really got to develop that skill while I was here, and I feel much more confident just going into some place and talking to people.
So my name is Candy Boer. I'm a registered dietitian at Tallahassee Memorial Cancer Center. I am a Florida State graduate, both undergraduate and graduate degrees from Florida State. I'm very proud of that. And my emphasis was clinical nutrition, as well as nutrition education and health promotion. And soon after graduating in 2010, I started working with Sodexo, with my home base being Tallahassee Memorial HealthCare, and I've been here ever since. And worked inpatient for about 3 years, clinical dietitian, and then moved over to the outpatient zone with an emphasis in oncology nutrition. I've been a specialist in oncology nutrition for approximately 8 years. I try to keep an open forum of communication with interns. If they are struggling with anything, I would hope there would be open communication enough that I can notice that, and they can tell me what's going on. But if I notice that there's any difficulties, I will let them know what the expectations are, and we can work through it. All right, so here at Tallahassee Memorial Cancer Center, we have 2 registered dietitians full-time on staff. And one of us primarily works in the radiation department, and the other one primarily works in the infusion or chemotherapy department. And a dietetic intern will spend some time with both of us. And both of us are certified specialists in oncology nutrition through the CDR. We both graduated from Florida State University. So we're both very proud of that, and we're always excited to have new FSU interns.
My name is Jennifer Tootin. I'm a registered and licensed dietitian. I've been registered and licensed since 2010, and I've been working for the Tallahassee Memorial Rehab Center since 2012. The Tallahassee Memorial Rehab Center is technically a step-down unit from the main hospital. We have all types of patients. As far as all the units of the hospital are potentially eligible to be a patient at the rehab center. We have everything from orthopedic patients who are post-elective procedures, it's like knee replacements, hip replacements. We also have cardiac patients, patients who have received coronary bypass grafting. We have post-stroke patients. We have really every kind of patient under the sun. The point of the rehab center is for the patient to be receiving more involved speech therapy, occupational therapy, or physical therapy. And so having a clinical dietitian there is just kind of having an adjunct support for those types of patients. But we can have anything from patients who are consuming things orally to tube feeders, and every once in a blue moon even somebody who's on TPN. So typical daily job duties as a dietitian at the rehab center is going to involve assessing every single patient, and that's literally every single admission that the rehab center does take in, and that is because the TMRC is unique in that they do have their long-term care license. We don't function as a typical nursing home. However, that facility does have the licensure for long-term care patients, which means that all of the staff have to follow policies and procedures that are done through the state of Florida to technically, as we're running a nursing home, even though, like I said, operationally from day to day, we do not function that way. So I nutritionally assess every patient, and then based on what risk level, why they're there, and things like that, then I assign them a risk level and follow up with them accordingly. And then also implement interventions that are obviously nutrition focused, make sure I'm monitoring them on a timely basis. I'm doing charting on a daily basis. I'm not only using TMH's unique charting system, but then also a system that's designed through the Centers for Medicaid and Medicare. We need to be compliant with that due to the long-term care licensure. Interns benefit most from rotations at the rehab center, approximately 1 to 2 weeks. It just depends on the individual intern, but for the most part, they can get a full, thorough rotation within 40 hours. Resources at the rehab center are, in today's day and age, a lot of it's going to be mostly available online, but we do have access through Sodexo. We have access to nutrition care manuals that are through the Academy of Nutrition and Dietetics, and then we also have specific diet manuals that are made through Sodexo. Interns, by the end of the rotation, at least having the confidence to go in and talk to a patient, asking relevant questions, and at that point, based on what they've learned from me, hopefully knowing what's relevant, to ask them how to properly perform a nutrition assessment. Expectations of interns just starting out in a rotation, especially their clinical rotation: flexibility, punctuality, dressing professionally, being able to communicate in a professional way to other disciplines. Positive attitude is really important. Students that may not be necessarily meeting the expectations during the rotation, I would just communicate with them throughout the entire process. In the beginning of any rotation, I would fully expect just to have a thorough conversation with the intern on what is expected as far as going over their competencies that they need to potentially accomplish, things that they may be particularly interested in, if we could address those, making sure that they're learning the unique aspects of what the rehab center in particular has to provide versus what another rotation codes. So every rotation is going to offer some basic general experiences and tasks and meet certain competencies, but I would try to make sure that that's fully communicated in the beginning, what they were going to expect from my rotation, and then every day giving them a feel for how they're doing, if they're needing to, not necessarily their attitude per se, but just all along the way, every day they can expect constant feedback with every task and every competency, and of course always encouraging them that they can ask me at any time for as much information as they need to accomplish a task or feel like they fully understand and completed a competency appropriately.